Hello, everyone. My name is Chao Jin from Department of Radiology, the first affiliated hospital of Xianjun University. Today, I'm very glad to introduce a recent paper published in Journal of Magnetic Resonance Imaging. The title is Auditory Effects of Acoustic Noise from 3T Brain MRI in Sedated Neonates with Hearing Protection. In this work, we focus on the MRI noise safety for neonatal populations. Introduction. It is known that MRI has been widely used in neonatal clinical management. However, equivalent sound pressure levels of 3T neonatal brain MRI can reach 102.13 dBA. Compared to adults, the middle ear muscle reflexes, which protect against noise-induced hearing loss, are weak or absent in neonates. In other words, neonates with immature auditory function, that is, weak or absent middle ear muscle reflexes, could be vulnerable to noise-induced hearing loss. Previous studies have found MRI noise-induced hearing loss, such as the transient threshold shift or altered cochlear function in adults. However, it is unclear if neonates show evidence of hearing loss following MRI noise exposure. The purpose of this study is to investigate the auditory function changes in two cohorts of neonates before and after undergoing 3T MRI with hearing protection, using acoustic emissions and auditory brainstem response (ABR) methods. This is a prospective study. As illustrated in this figure, we recruited two dependent cohorts of neonates to respectively track the changes in hearing function before and after MRI exams. In cohort 1, we first recruited 40 neonates and excluded the ones with abnormal hearing function and ones who cannot perform the MRI and ABR tests. The final number of subjects is 19. In cohort 2, we finally included 18 neonates. Assessment. In cohort 1, we utilized the ABR test to measure the functional status of auditory nerve and brainstem neonates. In details, hearing threshold lattices for wave 1, 3, and 5, and the interpeak intervals for 1 to 5, 1 to 3, and 3 to 5 were measured. In cohort 2, we used the DPOE test to measure the cochlear function by 6 DPOE levels at frequencies of 1.2, 1.8, 2.5, 3.5, 5, and 7 kHz. Statistical analysis. In this work, the Wilson sound rank or PIT tests with Bufferonics correction were used to compare the differences between baseline and follow-up ABR and DPOE measures. Results. The entire MRI examination lasted 38 minutes and 28 seconds for cohort 1 and 41 minutes 21 seconds for cohort 2. The average equivalent sound pressure levels range from 103.5 to 113.6 dBA. The estimated hourly noise doses were 103.5 and 105.2 dBA for cohorts 1 and 2 respectively. As shown in this table, there were no significant differences in terms of gender, gestational age, postmenstrual age, birth weight, or disease types between cohorts 1 and 2. In cohort 1, bilateral ABR hearing thresholds at follow-up showed no significant difference relative to baseline. In addition, as shown in this figure, the ABR wave measures, that is, the wave 1, 3, and 5 lattices, and interpeak intervals of 1 to 3, 3 to 5, and 1 to 5 at follow-up showed no significant differences from the baseline. Similar results were found in cohort 2 as shown in this figure. There were no significant differences between baseline and follow-up in left or right ear DPOAE levels. Discussions. 3 aspects may explain the no significant results in neonates following MRI noise exposure. The first is the noise dose. It is estimated that the hourly noise dose reaching the neonatal external auditory canal is about 90.3 dBA, which were within the IEC MR safety limit of below or equal to 99 dBA. The second is the auditory anatomy. Neonates have a smaller tympanic membrane size and a shorter external auditory canalars, which limits the sound pressure level transmission. In addition, neonates have a higher hearing threshold of about 10 dB than adults. The last is the hormone levels. The elevated thyroid hormones and estrus and sedation conditions in neonates may have a protective effect on auditory system. Conclusion. Noise from a single 40-minute 3T MRI scan with equivalent sound pressure levels of 103.5 to 113.6 dBA did not result in a significant transient effect on auditory function measured by ABR and DPOAE levels in neonates with hearing protection. This may be related to the distinctive auditory structures and hormone levels of neonates and the potential protective effect of sedation. That's all. Thank you for your listening.